Hello, we are live now.
Okay. So Kavita Hendik here. We'll be meeting our doctor today, and I would like to welcome our doctor here. She is Sumita Gogoi Hazarika from Tezpur, and to all the new viewers who have joined us now. So this is a platform which Jury has given to people who can come out for to promote various initiatives and attempts to bring social change and leadership skills to people who have come out in Assam and Northeast. So through this platform, these are some great people who are doing great work for the society, and Jury has given them a platform. And this is a non-profit platform, so the invited speakers are here to bring a change in the society. So this webinar series, which was started in July last year, through this, Energy has tried to build a network among people in the Northeast by inviting speakers from various fields to join them and to bring forward some issues that we see in our society. So I welcome you all. I welcome Doctor. We are here today to discuss some issues regarding our women health. So, community health for women, that as a gynecologist, since you are dealing with so many um, related things that women go through, and what every girl wants to know. A girl, maybe she is not able to talk to her mom, she's not able to discuss this in the schools and colleges. So there are so many things that you can actually go ahead and tell us today what we need to know. So, yeah, I would like you to start this session with us.
Good evening. Thank you, Team Anajury, for having me, and thank you, Kavita, for your kind words. So the day the Anajury team contacted me, I thought I would speak on the topic which is very close to my heart, because I have been doing a lot of work on this, trying to create awareness about menstrual health and
Yeah,
hygiene among teenagers and among women of reproductive age group.
right.
Now, this menstruation subject has been a subject of many myths,
Yeah,
many taboos,
yeah,
and it is also the medical from the medical point of view. It is also a subject which has a lot of poses a lot of difficulties nowadays when we deal with patients, because we get many patients. I think out of every 20 patients we see in the OPDs, about
yeah.
5 young girls or women of reproductive age group turn up with a lot of menstrual issues.
Okay.
So this is a subject which is very close to my heart, and I thought, this is in the beginning of this series, I would like to speak on this.
Yeah, very good. That
Yes.
is the need of the hour, I think so, because these children, starting from the age onwards, from 12 to 19 years, I've seen they're so much under stress nowadays. It's been so competitive out there, and
Yes.
yeah, maybe going through so many stages of changes, physical
True.
and emotional changes, psychological changes, and then this coming into since our society is like that, it's a developing country. We are not. It's not openly. Even girls going to a medical store to get sanitary napkins is like they hide from
True.
everyone.
True.
So
True.
yeah, I would really appreciate if you can just guide them now some of the questions that they need to
True,
be.
true, true. Because there are so many myths surrounding it. Even
Mm,
today, I was seeing a patient. So there was this a girl
yeah.
who was not getting her menses like on
Okay.
time. They were all the time delayed, and she was washing her every day. I said,
Oh,
And she told me, I'm washing my hair every day because somebody told her if you wash your hair every day, you'll get your menses.
oh God. Okay.
And then on the flip side of it, I met this lady who's expecting.
Okay.
For the last 2 months, she has not washed her hair because somebody told her that if you wash your hair, you're going
Oh,
to get your menses. So she's like 8 weeks down with a
okay.
pregnancy, who's not washed her hair for 2 months because
My,
somebody told her if you wash your hair, you're going to get your menses. So you see,
Right.
these are actual facts which we face every day, and
Yes,
it's
because you're
so
working with them, you know
yes,
what
yes.
every day these people
Too
are going to.
many myths, too many taboos,
Yeah.
and it's a subject where nobody wants to speak about basically. So I
Yes,
think
basically, that's
yes,
what.
yeah.
Even
This
moms are not like that because they have been brought up like that in a
yes, yes,
society.
yes. So I
So
think yeah, this is something which I would like to really dwell upon, and I hope my slides give you some amount of information. And anything else, any more queries which we have, we'll take it as we
we'll
go
take it
along.
after. Okay. So first we'll go ahead with the slide. Okay, so this will be speaking about, this is an informative slide. So you would like to say something about this, doctor?
Yeah, this so basically this is a community health initiative, and our goal is to improve the health awareness among adolescent girls.
Yeah.
So at the beginning of the session, I would like to take you to an incident which happened in the early part of 2020.
Okay.
2020 was supposed to be a year of women's empowerment.
Yes.
Believe it or not, 70 female students who were
Yeah.
studying, yeah, in a school in Gujarat
Mm.
was called by the principal. They
Okay.
were asked to remove their undergarments, and the teachers were made to check whether they were having their menses or not.
Oh.
Now, how did this situation arise? You know, because there was the hostel warden had complained that during menstruation these girls were not supposed to come to the common dining area, they were not supposed to step out of their rooms, and it seems they were doing so. And
Oh.
when the girls were asked, they said no, they were not menstruating, and they were not believed. So they were that's why they were all brought to the principal's office, and one by one they were checked, you know.
Okay. And this is
So
very sad.
this is like a true incidence, yeah,
Yes.
which happened.
Okay.
Because apparently when a girl is menstruating, she's not supposed to go into common areas or enter kitchens or go to classes.
Yes, this is the
Yes,
traditional way that they have
yeah,
been kept
yeah,
like that. Yeah.
yes, yes, yes,
Even not going to temples, and then
of
you're
course,
impure. You're not
of
supposed to
course.
touch even the pickles and all. No, they are not
Yes,
able to.
not pickles, no
Yeah.
curtains and whatnot.
Yes.
Yeah, yeah,
Yeah. Yeah. And if you're married, you're not allowed to sleep with the husband. Also,
of
you're
course,
supposed to
yes.
sleep. Yeah.
Or sleep separately,
Yes,
or sleep
separately.
in a separate room. Yes, yes,
So it is made into an impure kind of a thing. But when
yes,
this
yes,
this is actually a womanhood celebration, now where you can actually a motherhood kind of a thing.
yes, yes,
So
definitely.
this
Yes,
is
yes.
biologically that you are supposed to go through.
It's a biological fact.
Yeah.
It's a biological happening which happens
Yes.
everywhere, even in the animal kingdom. So
Yes.
yes, can we
Yes.
go on to the next slide?
Yeah.
So
So
yes,
yeah.
this all this menses is definitely a part of a normal reproductive cycle. And will you
Yeah.
believe it or not, when I started trying to find out how this myth had originated,
Yeah.
it seems back in the Vedic times,
Mhm.
Indra apparently killed an asura called Vrithras,
Okay.
and so Vrithras was supposed to be a Brahmana. So
Yeah.
when Indra killed a Brahmana, he committed a grave crime, and this guilt of killing this gentleman was given to women. So they would have it every month as the menstrual flow, as a part of Indra's guilt. So this is one of the basic myths which surrounds
Okay.
menstruation. Yeah.
Menstruation. Yeah.
So yes, what do you do if you're a Hindu woman? What do
Yeah.
you do when you get your menses? You are not supposed to enter the puja room.
Yes.
You are not supposed to enter the kitchen.
Yeah.
You have to be purified before you are
Yeah.
allowed by the family to join the normal way of life.
Right.
They cannot prepare food
Hmm.
and touch stuff like pickles, as you said.
Yes. 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 Yes.
And all the menstrual clothes have to be hidden or buried, because
Yes.
apparently some evil
Yeah.
spirit might cast a spell.
Yeah. Yeah.
Also, you can use it to cast a spell on men, it seems. I don't know. All the stuff.
Okay.
Yes, yes.
Mics are there. Okay.
And you cannot have a bath in the first few days.
Yeah. They are not, so for 3 days they are not supposed to take bath.
Take a bath, and
So where
then
does hygiene? Where does hygiene come?
yeah, you're like complete. The hygiene is completely out of the picture. When you're
Yeah.
supposed to be, you're supposed to keep yourself clean.
Okay.
and you're not allowed to have a bath, and then you cannot touch a cow,
Yeah.
and all those kinds of myths
Yes.
actually.
Yeah.
So now what happened is that this is something we wanted the school authorities to be aware of. We should be having menses without fences.
Uh-huh.
So what happens, 23%, almost 23% of girls in India drop out of school when they go to when
Yes,
they start
very true.
menstruating. Yes,
Very
yes.
true. Yes, that I
Be-
have seen because I work with those underprivileged children. So
Hmm.
I've seen that the girl child is kept at home because she has already started menstruating.
And
So
because most of the schools are gender unfriendly, they don't have
yes,
proper infrastructure, they don't
yeah,
have a separate toilet for girls, they
yeah,
cannot give sanitation facility for their female staff as well. So it's a problem for teachers as well.
yes,
Not just the girls, but
yeah,
even the
yeah,
female teacher face a problem because they don't have
yes.
toilets, proper toilets, proper
Toilets, yeah,
sanitation. Yes, yes,
yeah, proper.
that's a big factor.
Yeah,
Yes,
yeah.
yeah. So now what
So they
happens?
have limited, yeah, limited access to hygiene. Mm.
Limited access to sanitary napkins, limited access to toilets, and whatever myths the
Mm.
mother, whatever myths have been thrust upon the mother, it is just passed on to their daughters.
Very true. Yeah,
Yes,
it has
whatever
been passed through
yeah,
generation to generation.
it goes from the grandmother to
Mm.
the mother, mother to the daughter, and just goes on and on, right? So this is what
Mm.
we call, like, it's a menstrupedia, it's like a Wikipedia or
Mm.
encyclopedia. You have a menstrupedia, all sorts of myths and taboos.
Yeah,
So
yeah.
this is, I tell
And
my
we worship.
yeah, we worship, we worship Durga and Kali every Navratri, but nobody,
Yes.
kinds of asks their menstrual cycle. So why are we go on and on about your regular women?
Yeah, but in Kamakhya, it's famous for the menstrual cycle period. Now
Yes,
that they
yes,
after that
yes.
they worship those
They
things. So
every year they have
yeah,
the goddess seems to have a menstrual cycle for about
yeah,
7 days. Yes,
yes,
yes.
yes, yes. So
Now,
yeah, we
now
come to the
that,
science.
yeah,
Yes,
this is, we come to the science part of it because that
yes,
was the myth.
yeah,
Now, I would like everybody to know that this is just a normal vaginal bleeding, and it's a part of a woman's body which happens every cycle.
yes,
All the body does is prepare itself for a pregnancy,
yes,
and if there is no pregnancy, it just is shed out
yeah,
as menstruation.
yes.
So whatever menstrual blood which comes out is part blood, and part of it is actual tissue of the uterus which comes out along with the blood. So
Right.
that is what it all is. It's just old tissue coming out with some blood collection.
Right. So here in যদি আমি অসমীয়াও আমাৰ গেষ্ট মানে ইয়াত
Huh.
অডিয়েন্স হ'ব পাৰে সো
Hi.
অসমীয়াত যদি আপুনি অলপমান এইটো জেনাৰেলি এটা হেৰি
Uh, uh, uh.
কনচেপ্টত বুজাই দিব পাৰে এই কথাটো
So এইটো actually menstruation টো হৈছে আপোনাৰ যোনটো আপোনাৰ শৰীৰটো নিজকে ৰেডি কৰে প্ৰেগনেন্সিৰ কাৰণে। যদি প্ৰেগনেন্সি হৈ গ'ল তো হৈ গ'ল, যদি প্ৰেগনেন্সি হোৱা নাই তেনেহ'লে আপোনাৰ মেন্সৰ লগত ব্লাডটো ওলাই যায়, অলপ টিস্যু যোনটো আছে ইউট্ৰাছৰ সেইটো ওলাই যায়। আৰু এইটো মাহে মাহে হৈ থাকে, প্ৰত্যেক মাহতে আপোনাৰ শৰীৰটো নিজকে তৈয়াৰী কৰে প্ৰেগনেন্সিৰ কাৰণে, মানে গৰ্ভ ধাৰণ কৰিবলৈ। যদি হয়তো হৈ গ'ল, যদি নহয়তো মেনষ্ট্ৰুৱেশ্যন হৈ যায়, সেইটোৱে কথা খালি।
হা মই সেইকাৰণে কৈছো যে যদি আমি তেনেকুৱা হেৰি বুজাব পাৰো এণ্ড অসমীয়াত যদি আমি সেইখিনিও আমাৰ অসমৰ যিমান মাইকী মানুহ আছে I hope that these people are out there watching you right now. So let's, yeah, make it a point to go through them, yeah, reach them.
সেইকাৰণে
Yeah.
পাকঘৰ, মন্দিৰ এনেকুৱা যোৱা নোযোৱা একো কথা নাই, কাৰণ এইটো নৰ্মেল হয়। এইটো সাধাৰণ ভাৱে আমি যদি লওঁ, এইটো খালি আপোনাৰ শৰীৰটোৱে নিজকে এটা গৰ্ভ ধাৰণ কৰিবলৈ নিজকে ৰেডি কৰে তাৰমানে।
ৰেডি কৰিছে হা, সেইটো নহলেও দিগদাৰি, হলেও
দিগদাৰি।
সেইটোৱে কথা।
গতিকে so most girls have their periods around 12 years. So
12 years on, 14 or 15.
12 বছৰটো এভাৰেজ বয়স হয় য'ত চব ছোৱালী বিলাকৰ মেনষ্ট্ৰুৱেশ্যন চাইকেলটো হয়। কিন্তু 10 আৰু 15 বছৰলৈকে আমাৰ ৰেঞ্জটো আমি ধৰো, 10ৰ পৰা 15 পিছত হ'ব পাৰে।
ওকে, মই ইয়াত এটা কথা সুধিব বিচাৰিছো আপোনাক যে যদি 14-15 ইয়াৰ্ছলৈকে হোৱা নাই Tetia, is there, matlab the girl should be come, I mean, she should come for a checkup with a,
See, আমি 16 বছৰলৈকে টাইম দিওঁ।
okay,
16 বছৰলৈকে যদি মেন্সটো হোৱা নাই তাৰ পিছতহে আমি বাকীখিনি চেকআপৰ কাৰণে ৰেকমেণ্ড কৰো। 16 বছৰ বয়সলৈকে আমি ৰখিব দিওঁ, কোনো কথা
ৰখিবলৈ
নাই।
ঠিক ঠিক
হয়, কিছুমানৰ 8 বছৰ বয়সতো হৈ যায়।
হা 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 তো
এইটো কথা মই কৈ দিওঁ যে মাক বিলাকক, আপোনাৰ মেন্স আৰম্ভ হোৱাৰ 2 বছৰ আগৰ পৰা আপোনাৰ ব্ৰেষ্ট ডেভেলপমেন্ট হয়, আপোনাৰ ষ্টন ডেভেলপমেন্টটো হয়। 2 বছৰৰ আগৰ পৰা 2 বছৰ আগত ষ্টন ডেভেলপমেন্টটো হয়, ব্ৰেষ্ট ডেভেলপমেন্টটো হয়, তাৰ পিছত মেন্সটো হয়।
মানে ফিজিক্যাল চেঞ্জেস টো আহিবলে হেৰি হয়
yes 2 years 2 বছৰ আগত ফিজিক্যাল চেঞ্জৰ পিছতহে মেন্সটো হয়।
মানে underarms or armpits or pubic hair heri hekini sab physical jo changes ahe
agot ahe last change to apuna menstruation to
hobo means hormonal changes ahibo etia
first hormonal changes er karone tekhetor swali joni breast development hobo tai underarms or tai
hair growth hobo
hair ahibo eloka khora change ar olop swali joni আর তার লাস্টৰ চেঞ্জটো হৈছে মেনস্ট্ৰুৱেশ্যন। আৰু কেতিয়াবা মেন্সটো হয়তো নৰ্মেল ব্লাডৰ নিচিনা নাযাব পাৰে, ইট মাইট নট বি লাইক আ ৰেগুলাৰ ফ্লো, ইট মাইট জাস্ট বি আ লিটল বিট অফ ডিসচাৰ্জ।
yes মানে muddy kind of a discharge
হব পাৰে
okay
now
okay
what causes a period?
yeah
so mainly we are dealing with hormones here, hormones like estrogen and progesterone. Those are the main hormones which deal with menses. আৰু এই হৰমন কিটা কাৰণে আপোনাৰ এই হৰমনৰ একচনৰ কাৰণে আপোনাৰ ইউট্ৰাছৰ ভিতৰ টিস্যু বিলাক বিল্ড আপ হয়। ইহঁতে মানে টিস্যু বিলাক ইউট্ৰাছৰ বনাই প্ৰেগনেন্সিৰ কাৰণে। সো বনাই যেতিয়া মাহটো শেষ হয়, যদি প্ৰেগনেন্সি হৈ গ'ল তো থাকি গ'ল, যদি প্ৰেগনেন্সি নহয় উইথড্ৰল হয়, লগালগ হৰমন কমি যায় আৰু আপোনাৰ টিস্যু আৰু ব্লাড ওলাই গুচি যায়।
right
তো সেই গোটেই প্ৰসেসটো 28 দিন মান লাগে এভাৰেজত। সো সেই কাৰণে আপোনাৰ 28 দিনৰ মূৰে মূৰে পিৰিয়ডটো হয়।
so এইটো সাইকেল এই সাইকেলটো চলি থাকিবলে আপোনাৰ যিখিনি বডিক লাগে মানে ইয়াত যদি নিউট্ৰিশনৰ কথাটো ইয়াত আহিব নে মানে কেনেকে
ইয়াত নিউট্ৰিশনৰ কথা এইটো কাৰণে আহিব কাৰণ আপোনাৰ এই এটা বডি ৰিদম থাকে, আমি সাইকেডিয়ান ৰিদম কওঁ। এটা অকল খোৱাই নহয়, ৰেগুলাৰ খোৱা that regularity to বহুত rhythm to বহুত important হয় আপোনাৰ বডি মেনস্ট্ৰুৱেল সাইকেলৰ কাৰণে। বহুত দীঘলীয়া টোপনি ক্ষতি হলে, বহুত ষ্ট্ৰেছত থাকিলে তেনেকুৱাটো আপোনাৰ মেনস্ট্ৰুৱেল ইৰেগুলাৰিটিজ হ'ব পাৰে। সো সেই বডি ৰিদমটো বহুত ইম্পৰ্টেন্ট হয়।
Okay, আচ্ছা আৰু এটা কথা আছে ইয়াত মই সুধিব বিচাৰিছো আপোনাক যে পিৰিয়ড হৈ আছে, এতিয়া ছোৱালীজনীক কৈ দিয়া হয় এতিয়া তুমি দৌৰিব নোৱাৰা, এতিয়া তুমি বহিব নোৱাৰা, জাম্প কৰিব নোৱাৰা,
কোনো কথা নাই এনেকুৱা কোন that is another myth। সেইটো কোনো আমি একচুয়ালি পিৰিয়ডৰ সময়ত জাস্ট পিৰিয়ডৰ আগে আৰু পিৰিয়ডৰ মেবি সময়ত আমি ইনফেক্ট এক্সাৰসাইজটো ভালকে কৰিব দিওঁ, বিকজ তেতিয়া কিছুমান ছোৱালীৰ প্ৰবলেম থাকে ন, ডিসমেনৰিয়া, খুব পেটৰ বিষ হয় মেন্সৰ, সেইটো কমেহে একচুয়ালি ইফ ইউ ষ্টাৰ্ট আপুনি যদি খুব এক্সাৰসাইজ কৰে। ইয়েস এন্ড কিয় মই কৈ দিওঁ বিকজ মেন্সৰ আগে আপোনাৰ এটা ব্লাডৰ বিল্ড আপ হয়, তাৰমানে ব্লাড সাপ্লাই বিল্ড আপ হয় ইউট্ৰাছত। তো নাও আপনি যেতিয়া এক্সারসাইজ কৰে, দৌৰা ধাপৰা কৰে, তেতিয়া সেই ব্লাড সার্কুলেশনটো মানে ডিস্ট্রিবিউট হৈ যায় বডিত। বাট ইনস্টেড আপনি যদি ৰেষ্টত থাকে, ব্লাড কনসেন্ট্রেটেড হৈ থাকে ইউট্ৰাছত, সো ইউ হ্যাভ লাইক হেভি মেন্সেস এন্ড সামটাইমস ইভেন খুব সিভিয়ার পেইন। বাট ইফ ইউ আর ভেরি অ্যাক্টিভ খুব অ্যাক্টিভিটি কৰি থাকিলে দ্যাট ব্লাড কনজেশনটো নহয়, ব্লাড সার্কুলেশনটো বেটার হয়, সো আপোনাৰ কমফৰ্টেবল হয় পিৰিয়ডছটো।
Okay, that's very good that you suggested this, because most of the girls they just lie down and just lock themselves for 2-3 days.
Yes, what we do actually is that we ask them to actually start exercising about 10 to 12 days prior to the menstruation.
Okay. So
cycling korak, dorak, so that that build-up of blood
yeah,
in the
yeah.
uterus
So
doesn't
at
happen.
least 2 weeks, from 2 weeks before they should go for cycling or
Yes,
yeah,
yes, yes.
normal
Yeah.
normal playing around with whatever they were doing, no? So yeah,
That is very important. And I would
yeah.
here like to add that, এইটো মোক খুব কমন কমপ্লেইন্ট হয় আমাৰ OPD পেশেন্টছৰ যে মেন্সটো বাইদেউ ছেপ্টেম্বৰ মাহত মেন্সটো হৈছে আজি নেক্সট বছৰ এপ্ৰিললৈকে মেন্সটো হোৱা নাই
Oh,
ইনিচিয়েলি যেতিয়া মেনষ্ট্ৰুৱেল চাইকেলটো ষ্টাৰ্ট হয় এইটো বহুত ইৰেগুলাৰ হয়
okay.
in say about 35 to 40% patients the cycles are very irregular. It will maybe come in not in months, maybe it will come in 2 to 3 months, or sometimes it will come every 15 days.
Right.
So in the initial first 2 3 years it takes a lot of it takes some time for the periods to be set in young girls because the hormone levels bilak mane apuna stable nohoy.
No, hi,
So
unbalanced
some
with that.
so that is fine like maybe 2 3 up to 2 to 3 years post
Yeah.
you get your menarche mensua pisoleke it might be a
Okay.
problem so that is
Okay.
fine.
So this is a normal period of 5 days that you say? Okay, that's a normal
Yes,
period.
yes. An average period would last for about 5 days. It can be shorter. কিছুমানৰ 3 দিনতো হয় কিছুমানৰ এসপ্তাহলৈকেও থাকে.
So is this because of this anemic condition where the blood iron is less, or is something
Not
to do with?
no,
Okay.
not really. It is basically to do with the hormonal play. কিছুমানৰ
Oh,
estrogen বেছি, progesterone কম, things like
okay.
that. It differs from person to person.
Okay.
But a period can never be longer than 7 days. Anything more than 1 week has to be looked into.
Okay. Then the doctor should be
Yeah,
there
yeah.
to
If
suggest
if you're
what has.
yeah, if you're getting
So
a
that
maybe
means
a
there's something wrong. Yeah.
yes, yes. If it's more than a week, it's going on for 10 days, 15 days, it
Yeah.
needs to be investigated. Yes.
Okay. Okay. That's good. And
So
yeah, I
yes.
would like to. Okay. Yeah, you go ahead. I'll ask.
Yeah.
Yeah.
So again এইটো বাইদেউ আমাৰ বহুত bleeding হৈছে বাইদেউ that kind of thing actually basically you just lose about a few tablespoonfuls of blood, a lot of tissue comes out so you think it's like very heavy bleeding.
Yeah.
So mostly it is blood and tissue mixed together.
Okay.
So
Okay.
in the first maybe a day or two it is bright red in color.
Yeah.
Yeah, a day or two later it becomes slightly dark and then it's just becomes a little pinkish and then goes off. This is
Oh,
what how the normal period goes about.
goes up. See.
এইটো নৰ্মেলি প্ৰথমতে একদম ৰঙা থাকে এদিন ছেকেণ্ড ডে অলপ কলাৰ নিচিনা হয় তাৰপিছত পাতলা গুলপীয়া মাছ ধোৱা পানী নিচিনা হয় নাইকিয়া হৈ যায় হয় ন চ' আপুনি কিবা এটা সুধি আছিলে ইউ আস্কিং মি
Yeah, yeah. I was asking you about the same thing because when it starts with the color, so I mean, after some age, when the women goes around 40 to 45, then maybe মানে হোৱাৰ আগতে অলপমান discharge আহি থাকে যেনেকে muddy discharge এটা brownish discharge তেনেকুৱা আহি থাকে. So
it
is
might
that
be.
normal, or is there any infection or something?
No, 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 no. If that premenstrual spotting, as we call it,
Yeah,
just before
spotting.
menses, you get a spotting. It's
Yeah.
quite common. It's common you in the adolescent girls. It is also common near menopause.
Okay. Okay. Okay.
Yeah,
Yeah, that's what I wanted to ask.
yeah, yeah.
So we'll go ahead.
So
Yeah.
yeah.
This is some symptoms that I would like to talk about. This is a very
Hmm,
important thing, that
hmm,
PMS, because I've seen girls going through that, women, no, especially, and working women also going through so many mood swings, and physically also cramps and bloating and those things. So, would like to hear something about it.
So what exactly maybe during menses?
Okay.
And
Okay.
they generally go away with the first few coming of the period or maybe a few days after the period.
Oh,
So what do the girls have? Some pimples,
yeah.
some have a sense of bloating or abdominal pain. There is
Oh,
frequently breast complaints, like they're very
yes.
heaviness. Yes,
Yes.
there's swelling of hands and feet.
Yes. Yes.
Some women have a migraine kind of a
Correct.
headache. We call it menstrual
Mm,
migraine.
mm,
Yes,
mm, mm.
excessive fatigue, like you are very down and you don't feel like doing
Yes.
things. And there are food
Cravings.
cravings, like you're very
Definitely.
hungry, you want certain kind of
Yeah.
food. There's always irritation, there are mood swings, there are anger, there is isolation, there's a
Yeah.
change in sexual desires, and sometimes disturbed sleep cycles.
Mm.
And sometimes there are people even cry for no odd reason.
Yes, yes, this happens with my daughter
So
also.
this is like
So
complete,
she,
yeah, this
yeah,
PMS or premenstrual symptoms are like completely normal.
okay.
So
So,
it's nothing much, but
yeah,
a lot of this can be alleviated with, say, good nutritional support,
okay.
uh, good psychological support,
Yeah. Mhm.
certain activities.
Yes,
As
yes.
I said, even the regular exercise also helps PMS actually,
Okay. Okay. Okay.
because
So,
most of these are due to, blood supply concentrations in certain areas. So once you start exercising, there's a
yes.
good greater and better distribution of blood flow. So
Okay.
like
So,
swellings,
আমি কিবা এটা খাব
tenderness.
পাৰো বা ড্ৰিংকস তেনেকুৱা কিবা
so
সাজেষ্ট
uh,
কৰিব আপুনি কি?
no, what we actually ask you to avoid is caffeine,
Caffeine. Okay.
that red meat.
Okay. Red
So
meat and
caffeine, red meat,
hmm.
and maybe it's not relevant in India. Abroad in Western countries, you're asked to avoid alcohol and smoking premenstrually. Actually,
Okay. Okay.
these
Okay.
things actually aggravate those symptoms.
Acha.
But lots of fruits, green leafy vegetables,
And for bloating and gas,
fish.
abdominal pain, is there something that they can have?
You can take your regular medications. You can take your drotaverine, your regular Meftel
Yes,
spas.
mental spas
All those,
helps.
yeah,
Yes.
those are really safe. You
Yeah.
can take them n number of times, maybe twice or thrice a day.
Okay.
Also, they will alleviate your symptoms, and there are no really bad side
Okay.
effects.
Okay. Okay. That's good. So this is how means the girls go through every month. They have to go through this. So
Yes.
there's so much going on, and on top of it, when the society also comes into
Hmm.
play, so everything goes haywire. Like মানে सब फलों पर एक लगे
Actually,
जड़ी
so
हाँ
that's very depressing when people say you
yeah
don't do
it's
this,
very
don't do that. You are having a discomfort. Will you believe it or
yeah
not? This is one of the reason. One of my distant relatives, her daughter was in the ninth standard. She actually committed suicide last
oh
May, once after the lockdown, because she was having depression, and she was suffering from depression. She was under treatment for depression, but she actually committed suicide during her menses, because I think she really
yeah
lost
during
it.
the hormonal imbalance na the emotions are too high to
Hmm,
understand
hmm,
what is
hmm,
matlab
hmm,
কি কৰিব লাগে কি কৰিব নালাগে সেইখিনি যদি টাইমত ইহঁতে গম নাপায় and in ninth standards a very young age na 13 or 14 maybe
maybe 15,
13 yeah
yes.
yeah so that is
So
such a sensitive age to be in
yes, yes. And you can safely take, as I told you, your analgesics like drotaverine and
yes
menfenamic acid. They are absolutely
yeah
safe.
yeah yeah
So that there's also myth surrounding them, that many people will tell you don't take painkillers. There are certain set of painkillers we really don't ask you to take,
hmm.
but there are so many other stuff which you can really take. Like
Yes
drotaverine and menfenamic, which is your Meftal
yeah
spas. Those are like completely safe. You can take about a tablet or 3 tablets a day. Even that is really
for the
fine.
cramps
Yes.
and for bloating and these things they
Yes,
help
yes,
a lot
yes, yes. You really need not
yeah
suffer. You can take your
yeah
medicines.
and when these girls nowadays the generation is like that they are traveling they are studying they have to be somewhere during the
Yeah,
they
they
just
have to be.
can't sit
Yeah,
at home no so
they have to be comfortable.
yeah yeah
They have to be
yes
comfortable.
yes
Yes.
so we have to be there for like women should stand for women that's what I feel
Yes.
so
True. True.
yeah
True. So I would like to touch upon the problem
yeah
areas. Okay.
mm,
Like as I said, you have crossed 15 and you are 16 and you have not started your period,
okay
and you have had your period for more than 2 years, but
yeah
still like does not come regularly.
yeah
So in between periods, you have something like an intermenstrual period, bleeding. Menstrual মাঝে মাঝে আপনার bleeding হয়ে
হৈ
থাকে।
থাকে
16 বছৰ বয়সলৈকে মেন্স হোৱা নাই।
হুম
আৰু পেইন কিলাৰ দিলেও মেন্সৰ ক্ৰেম্পটো ঠিক হোৱা নাই। লাইক খুব বেছি ব্লিডিং হৈছে, আমি খুব বেছি ব্লিডিং, হাউ ডু ইউ ডিফাইন ইট, কেনেকে বুজাও? 1 ঘণ্টা মূৰে মূৰে আপুনি পেড চেঞ্জ কৰিব লগা হৈছে,
Okay.
চ' দেট ইজ হেভি ব্লিডিং।
Hmm.
এসপ্তাহৰ ওপৰলৈকে আপোনাৰ ব্লিডিং হৈ আছে, আপোনাৰ বন্ধ হোৱা নাই, আৰু আপোনাৰ লাইক প্ৰি মেনষ্ট্ৰুৱেল চিমটমটো ইমানেই বেছি চিভিয়াৰ হৈছে that you cannot go about with your daily activities, normal routine, উঠি পেলাই উঠি ইফালে যোৱা সিফালে, মানে normal routine gets disrupted. So these are the problem areas. Yes.
Yeah. So we need to work on this. Or
Yes.
apni sage etu kaam kori ase no bahut sage tat.
No, we advise certain supplements, and then we exercise. We try ask them to try out lifestyle changes. You know.
Okay. Kintu apnar usor tenuka heri ahi thake patients jone.
Prior.
Okay. Okay. So apni mane moi eta kothai hudibo bisarisu yat je society je ami kiba eta jodi koribo paru hetu awareness কৰিবলেও চাগে আপুনি কাম
কি কৰো, স্কুলত যাওঁ সাধাৰণতে, গাৰ্লছ স্কুল বা এনেকুৱা, চ' তাতে গৈ আমি এৱেৰনেছৰ কাৰণে প্ৰগ্ৰেম কৰো, চেনচিটাইজ কৰো, জেণ্ডাৰ লাইক ইউ হেভ টয়লেটছ বিলাক ঠিকে ৰাখিবলৈ, টেম্পনছ বিলাক ডিষ্ট্ৰিবিউট কৰিবলৈ। আজিকালিতো বহুতখিনিয়ে আফটাৰ দ্যাট মেনষ্ট্ৰুৱেল মুভমেণ্ট ইট হেজ ৰিয়েলি কাম আপ ইন এ বিগ ৱে।
Yes, last some years the estimated women health whatever they have shown, it's good ki at least they are going into a hygienic condition.
Yes, bahut ajikali tampons are like most bahut skule rakhe ajikali stock.
Acha, so what do you prefer, pads or tampons? What is a good
I would like to come to that, because it also depends ki bostu apni tampon to use koro, apnar it will depend on your age. It depends on the kind of work you do, ki kaam kore.
Yes.
Okay, so these are two important facts. Tomar boyok to kiman aru tumaluke what ki kaam kore manu goraki. So that depends. So I'll come to it one by one. If you can just move your slides, because I have So this is like this is why we started it all, because 50% women India to najane ki koribo lage. They use dirty linen and dirty clothes and end up with a lot of infection. Only 16% can actually use the market sanitary napkins. So expensive.
Because I work with women in the underprivileged section, so I know that it's very costly for them to arrange a packet of 10 pads or and then there are 5 girls around in a home, so where there are too many children.
Yes, you see, if you have like 5 daughters, so you see the amount of cost involved in purchasing.
So they use cotton clothes, old clothes.
I'll come to a very interesting fact as we go along. You'll be very surprised to know. Can we move the slides?
Yes.
So when we say ami jetia kom menstrual hygiene, menstrual health, ami ki bujao? Access to menstrual hygiene products, yes, ami jate hygiene products, sanitary napkin hok, tampon hok, hetu apunar swali joniye ba manu gorakiye readily available pao. বস্তুটো এভেইলেবল হলে নহব, চেঞ্জ কৰিবলৈ জায়গা লাগিব।
ঠিক কথা।
proper place to change the materials hygienically, and thirdly to dispose the used materials.
Very true.
The disposal is also such an important factor.
Yes.
So there are 3 things, availability of the material, privacy to change the material, and disposing the used material.
Important.
So 3 important
important.
Yes. Can we go to the next? Yes. Now what happens when you lack menstrual hygiene? Mensor সময়ত যেতি আমি ঠিক ধৰণে যত্ন কৰিব নোৱাৰো, কি হ'ব পাৰে? Increased risk of urinary tract infection. খুব urinary infection হয় ছোৱালী বিলাক।
Yes. Rashes.
Yes, rash hoy, আৰু genital rash, because বহুত long hours এটা পেডকে 10-12 ঘন্টা ইউজ কৰি দিলে, you have genital খুব হে এৰিয়া বিলাকত itching, rashes hoy, খজতি hoy, your reproductive health goes down, and you are actually in turn increasing your chance, because of all these various infections, your chance of cervical cancer actually increases. So that is why it is important to have menstrual hygiene. So we reduce everything. Now, সৰু সৰু কথা কিছুমান কম that কিমান ঘনাই আমি চেঞ্জ কৰিব লাগে
Yes.
sanitary napkin. We recommend 4 to 6 hours. 4 পৰা 6 ঘণ্টাৰ ভিতৰত আমি চেঞ্জ
Okay.
কৰিবই লাগে।
That is the
আৰু
ideal
কিয়
time.
চেঞ্জ কৰিব
Ideal
লাগে?
time.
That is the best time, yes. আৰু কিয় কৰিব লাগে? Because মই আগতেও কৈছো ইয়াত dead tissue থাকে, ইয়াত blood থাকে।
Yes.
So it is like a fertile ground. এইটোৰ নিচিনা আৰু মিডিয়াই নাই গ্ৰ' কৰিবৰ কাৰণে of various bacteria and fungus and all sorts of organisms.
Mm-hmm.
So it's like an ideal environment for them to grow.
Yeah.
And so together with the body warmth and all the raw
Moist.
materials are supplying, yes,
Moist.
the bacteria and virus, they grow, and fungus, they grow all over and proliferate, and you end up with these lots of infections, as I told you.
Right.
So that is why you need to keep changing your tampons or pads or whatever every 6 hours.
Yeah.
Yes.
Right.
Now, this is a very important point. You need to wash yourself properly. Now, how do you wash yourself properly? There is actually a method.
Yeah.
You actually wash your hands in a motion which is from front to back, like you touch
Mm.
from vagina to the anus and never vice versa, because
Right.
you'll be introducing the organisms in the anal area to your vagina.
Okay.
When so it is always from front to back,
Yeah. সেই
and
কথাটো
never
বুজিব লাগে. Yes. This is
from
something. Yeah.
আগৰ পৰা পিছলে ধুব লাগে সদায়,
Yes.
and
Yes.
never from back to front.
Yes.
Yes.
Right. And this is another
So
thing that they should know, that for the
yes,
soaps.
yeah, yes. See, there are a lot of things which come in the market,
Mhm.
but basically you just need plain clean water to wash yourselves.
Yeah, there are so many washes, V wash and anti
Yes.
wash. There's so many things that are there.
So basically you should not be disturbing the pH, as we call it. The environment should not be disturbed, because you also have healthy bacteria, healthy fungi,
Yeah,
healthy organisms alongside your
which
bad
are
ones. So you
helpful.
don't
Yeah.
want to remove the healthy
Mm-hmm.
ones. You don't want to remove the healthy. যোনবিলাক ভাল organism সেইখিনিকো আপুনি ধৰক খুব বেছি sanitize কৰিব গ'লে, you sanitize কৰিব গ'লে সেইখিনিও মানে আপোনাৰ
উলিয়াই
ভাল
দিছে গাৰ
bacteria
পৰা.
you eradicate হৈ
Yeah.
যায়. So that also is very difficult.
Yeah.
Now again, how sanitary napkin to কেনেকে discard কৰিব লাগে, it is
Yeah.
very important. You should, it is a খুব common problem, especially girls hostel. Actually it is such a common problem. Tejpur University VC request কৰিছে hostel গৈ ক'বলৈ, do not flush it down the toilet,
Okay. Yes.
because most of them will flush it down the toilet, right?
Yeah,
Because
and it blocks the system, sewage system. Yes.
yes. And then you actually need to wrap it up properly, pura dhaki dhuki bhalke, so you don't want things to go out, or whatever infections to be
Yes,
localized.
spreading infections around
Yes,
unhygienic way. Yeah.
yes,
Yeah.
and also wash your hands properly.
Hmm.
There's one very important thing. Most girls, you will ask them, they'll say, I use two pads at the same time.
Oh, okay.
So that is like very silly, because you see that is waterproof. This is not, you're better off changing it every 4 hours rather than using two together. It is
So
not
different.
recommended. Yeah,
Okay.
it doesn't help because it doesn't soak really.
Very inconvenient also.
Yes, very inconvenient.
Uh,
It's not comfortable.
yeah.
And secondly, you should not be combining, like you are using a tampon, on top of it you're using a napkin. You should not
Okay.
overlap methods.
Okay.
Choose one and use it wisely.
Yeah. So
So
what to choose?
now what to choose? Now, will you choose disposable? Will you choose reusable? Now, disposable sanitary pads are like available. It's over the counter. It's all across the market.
Mm.
But but reusable sanitary napkins are like cotton ones, which are really breathable and unscentable. Now, for us, the disposable. There's a very important thing. The World Health Organization did a study, and they found out that the sanitary napkins, disposable sanitary napkins, actually contain a lot of chemicals which really harm your female genitalia. So we'll come to the
Oh,
next
okay.
slide. Yeah.
Yeah.
So that part I'm going to cover a little later. Now,
Yes.
I want to tell you how to use actually it properly. You just remove the back paper, place it on your panty, remove the center of the pad, and flip open the wing, stick it to the side, and just use it. This is
Yeah.
something we tell the girls to do.
Right.
Yeah. So now what happens when you use disposable
Mm.
pads, those sanitary chemical
Yeah.
ones which you get on the
Yes.
yeah,
Yes.
it's very easy to use, you readily available, it's a very good for your active lifestyle,
Right.
like you're on the go, you're working in an office, you're going to school,
Mm-hmm.
and there is minimum chance of leakage. So most of the girls who are working women, who are going to colleges, we are going to schools,
Mm-hmm.
are you have a preference for
Yeah.
disposable plates. Now, what are the disadvantages of disposable pads? Because you see, all of them are white in color. If you have noticed, they're
Yes.
like white and bleached.
Bleached. Yeah.
They're actually white in color because they're using a chemical called chlorine.
Okay.
Now, that chlorine has a byproduct which is called dioxin.
Mm-hmm.
Now, this is like a major threat to your female genital system.
Oh, okay.
Okay. So they contain a lot of residues which harms your genital area.
Okay.
So, and besides that, the entire plastic thing, which because we like it because it seals the
Yes.
leakage,
Yes.
it seals the
Yeah.
leakage, but you also, it traps the airflow and heat in the vagina, right?
Yes.
So
Yes.
that like promotes a lot of germs to grow in your system.
Yes. Yes.
So
Yeah.
can we move? Yeah. Now, reusable cloth pads are the latest
Okay.
fad nowadays, and we also recommend, like, if you're a working woman,
Mm-hmm.
you use the disposable ones while you're working, and you can use the reusable ones when you're home.
Okay.
You can also switch your pads.
Yes. Yes.
Now, they are very comfortable, very less irritating. They've got very good cotton fabrics which allow airflow and allow the body to breathe as
Yeah.
well.
Yeah. Yeah.
So there are less chance of
Allergy and
allergies and
infections.
risks.
Okay.
Yes, yes, yes. The disadvantage is that you need to
Okay.
wash it.
Right.
That's very time
Right.
consuming, right? And many women don't like to
Yeah.
do that.
Uh,
And now you need to wash it, clean it, dry it. So many family members may object to
yes.
that.
Yeah, like
So
the
general,
you can't
yes, the
dry
whole
it. Then
concept,
again, you
yeah.
have to hide it somewhere and do those
So
things.
that is, but on the, if you, I would really recommend, using both methods
Yes.
partly.
Yes.
You use your disposable pad when you are working
Yeah.
or you're on the go, and when you're home and you're rest,
Yes.
like maybe sleeping, you can use the cloth
Yes.
pad, which is really good. Yeah.
Yeah. The
Okay. The
cups.
menstrual cup is the latest thing which has
Yeah.
come out. They are, they come in different sizes, and it's basically a silicone
Yeah.
device. So, and they last for years. So, they are kind of environment friendly too.
Okay.
So it's just like a cup, it's a funnel shaped cup with a stem.
Mm-hmm. Yeah.
They don't dry your vagina. They don't cause things like TSS, which comes with tampon use. There are no chemicals found here.
Okay.
And, you have less, kind of, the airflow is not blocked. So there is less chance of having an
Infection.
infection. And then you can keep it on for 2 years. Of course, as I said, it's
Oh.
environment friendly
Okay.
because you don't throw it away. It's very easy to, wash.
Yes. Yes. You don't have to show it outside also, like with
Yeah.
the cotton
And
cloth
the
and everything. Yeah.
difficulty being is that it's very messy. It takes a time to get used to it.
Yeah.
So many women have a difficulty in inserting or removing it. It's
Okay.
difficult to
Okay.
find the right fit.
Acha. Acha.
So those kind of things.
Okay.
Now the tampon is another thing which came out in the late 70s and 80s, but
Yeah.
we do not recommend that now because you see this is very invasive. You actually insert it in your vagina
Yeah.
and you keep it on for hours and hours on the end, which is
Yes,
like,
and
yeah,
I've heard about this. Ki even girls, they just forgot that they have inserted thing,
that
and then they went
they,
into a shock. Yeah.
yeah, that's what I said. That's like a
Yeah.
toxic shock syndrome. It comes with
Yes.
tampon use.
Yes. 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 This has happened.
So
So
this is
the pros
most,
and cons
yeah,
are
the
there.
pros
Yeah.
and cons is like if you're an athlete and you're like swimming and you can,
Yeah. Yeah.
yeah,
Then you can use it for some time,
yeah,
but maybe.
for some time,
Yeah.
yeah. And so the basically it's your
Yeah.
choice. I would myself recommend maybe sanitary napkin together with the menstrual
Yeah.
cup at times.
Mm-hmm.
Like on the day one, if you have very heavy bleeding, you use a pad.
Mm.
Then in the evening at home, you can use a cloth pad,
Cloth
or
pad.
you can
Yeah.
switch over to a menstrual cup.
Cup. Yes.
You
Yes.
can a combination of all methods one at a time.
One at a time. Right. Right.
So yes, and associated with all menstrual issues, we have this common issue called anemia.
Huh.
Like 58% of children have it, 53% of non-pregnant women have it, and 50% of pregnant women have it. This is the disease burden in India.
That is right.
So,
Maybe because of the food habits or something that they are not
so
able
yeah,
to
yeah,
get
yeah.
nutrition. Huh?
Nutrition is a big factor together with environmental factors as well,
Yeah.
because we live in a tropical country,
Yeah.
so that's like a heaven for your worms and other
Yes,
infestations.
yes.
Now, yes, and these are the causes which we underline.
Hmm.
It's like an iron or a B12 deficiency.
Yeah.
There's a lot of poverty, malnutrition, poor sanitation, and you have a vegetarian diet which is not
Balance,
balanced.
right.
Lot of worms infestation as well as infections like malaria, and then you also have very heavy losses during
Okay.
menses. So these are some of the causes.
Mm-hmm.
So anything less than between 10 to 11 is a mild anemia, 7 to 10 is moderate, and
Okay.
4 to 7 is like severe anemia.
Any.
This is the WHO
Okay.
format.
So you register these kinds of cases also with you? They
Yes,
come.
yes, anemia is very common.
Okay. Okay. So this is the food chart that you have
Yes,
here.
yeah. This is a food chart I've just placed. This is like
Hmm.
iron in plant foods for those who are like vegetarian
Okay.
people. You can go for
Broccoli.
broccoli, that's like a really green vegetables. Anything colored will have iron in
Yes.
it. Like broccoli, like tomatoes, like anything which is color
Mm-hmm.
has lot
And
of
easily available like spinach and
yes,
green peas and
your
this. Yeah. Yes.
bananas.
Yes.
Yes, spinach is available.
Yeah. Grapes are
Yes,
available and these
grapes are
things.
available.
Yes.
Yeah,
Yes. Yes.
beetroot is available.
Coconuts are available. So there's
Yes,
so
yes.
many things that we can actually have. Yeah.
Yes, yes,
And
yes. And
vitamin C. Yeah.
if you're a non-vegetarian, then your chicken has a lot of, your fish has a lot of
Iron.
iron.
Mhm.
Yes, yes.
Okay. Okay. That's good.
And remember,
Yeah.
can I have the last
Yeah.
slide?
Yeah.
Because I want to tell you about some helpers, okay?
Okay.
There are some helpers which help your body actually to retain iron, like vitamin C.
Okay. Yes.
So if you incorporate a lot of vitamin C in your diet, like lemon
Oranges.
juice or oranges, yeah, or gooseberry,
Yeah.
amlokhi junto koi no,
Yes. Yes.
vitamin C helper hoy, iron helper. So they
Mhm.
keep iron or body rakhibo help kore.
Okay.
Aru eta bostu ase blockers like kosu, no, cassava, kosu, sah, tea, coffee, all that stuff. They are like iron blockers.
So
When you have
they won't let your
yes,
body absorb the
yes,
iron that you are
yes.
having actually. Okay.
Yes. So if you have like now suppose you have say you're having almonds which is very rich source of iron with a cup of tea.
Yeah.
So you will not be absorbing the nutrients from almonds with a
Oh,
tea.
okay, okay. This is something to note down for everyone. Maybe this
Yes,
will
yes,
help them a
yes,
lot.
yes,
Yeah.
yes, yes. So you have to be very and phytates,
Hmm.
of course. Couple of phytates are there. So these are the basic things. You have almonds with a tea, and you're thinking I'm having almonds every day, and I'm not my HB is not rising because
Ah,
the tea will not let the iron inside the body.
right, 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 right.
So these are a list of 5 Indian foods which are abundant in iron, like dried fruits, legumes, dal, nuts, seeds, and green leafy vegetables.
Right.
So, can I have the
Oh,
last
yeah,
slide?
sorry.
Yes.
Yeah, sorry.
Yeah. So, like how do you balance your diet?
Hmm.
So, if you're a non-vegetarian, your animal foods will give you a lot of protein, vitamin B12, as well as iron.
Okay.
Now, when you have cereals, bread, or vegetables, you combine in with milk or egg, which will give you protein and iron as well, because even protein is a very integral part of
Yeah.
hemoglobin.
Mhm.
You finish your meals with vitamin C, I told you that will increase your iron absorption.
Okay.
So for snacks, you can have dried fruits and nuts.
Mhm.
And then maybe one meal you can just include a little bit of green vegetables, that will give you folic acid. That also will increase your iron.
Okay. Okay.
Yeah.
This is
And
deep.
that's an important part. Yes, the deworming part is very important in a tropical country like
Hmm.
us, or in a tropic in a আমাৰ পেলু প্ৰব্লেমৰ কাৰণে বহুত হেমোগ্লোবিন ডাউন হৈ থাকে ছোৱালী বিলাকৰ
Yes.
সো ছমাহৰ মূৰে যদি পেলু দৰব এলবেণ্ডাজল ইজ এভেইলেবল য'তে প্ৰাইমেৰী হেল্থ চেণ্টাৰ চবতে থাকে এইটো
Mhm.
সো বছৰি দুবাৰ যদি ডিৱৰ্মিং কৰিব পাৰে
Hmm.
তেনেহলে তেনেকুৱা বহুতখিনি হেমোগ্লোবিন ইম্প্ৰুভমেন্ট দেখা যায় over a period of time.
Hmm. Take.
So, as I said, I end, the health of a mother and child is a very
Yeah,
important telling measure of a nation states than most economic
very true.
indicators.
Very true.
Yes.
Okay, so we'll yes, doctor, that was a very interesting information that you have shared. And yeah, I would like to ask you about the nutrition, like you said, that if the nutrition part is taken care of the young girls, maybe they grow up to be more stronger and more capable of taking on the day-to-day challenges. Because I have seen ki our society বেছিভাগ কি কয় সেইটো হেৰি heavy lifting and everything, it is done by the women,
Yet,
whatever household things. So because in this period when the menstruation is going on, at that time she needs to take care of her health, maybe because they have those cramps going on and those ways of body reacting to the hormonal changes and everything. So at that time, if the nutrition of a month that she has carried on with her, so that will definitely help her for these 5 days. What do you say about that?
yeah, definitely. You know that nutrition part. At আমাৰ এটা কথা আছে, আমাৰ medical science ত anemic mothers ৰ পৰা সদায় anemic ছোৱালী হয়. You
Yes.
have anemic mothers, anemic daughters, and from anemic daughters you get anemic granddaughters. So
Mm.
there's like a whole cycle of malnutrition
Yes,
which sets in.
yes, yes.
So hey cycle to কোনোবা এটা পইণ্টত with good nutrition you have to break the chain. সেই চেইনটো মানে সেই চাইকেলটো ভাঙিবই লাগিব। আৰু খুব এক্সটিক, খুব সাংঘাতিক বেছি বস্তু খাব নালাগে।
Mm.
এভৰি ডে লাইক আমাৰ ইয়াতো ব্ৰকলি, এতিয়া পালেং শাক, ব্ৰকলি, এইবিলাক বস্তু, আমলখি, নেমু, এইবিলাকতো এভেইলেবল বস্তু
Available.
হয়। শাক পাচলি,
Yes.
শাক আমাৰ গ্ৰীণ কিমান ভেৰাইটি
ঘৰে
শাক থাকে
ঘৰে
আমাৰ অসমত। ঘৰে হয়, ঘৰকে things in the right way, ঠিক ধৰণে যদি এইখিনি মিলত ভৰাব পাৰো, আমি খোৱাৰ লগত আমি মিলাই পেলাই খাব পাৰো, বহুতখিনি আপোনাৰ প্ৰব্লেম হৈ যায়।
আচ্ছা, আপুনি এইটো কথা ক'লে যে টিনেজাৰ এটা সুইচাইড কৰিছে, কি জনাব বিচাৰিছে যদি আপুনি কিবা এটা কয় যে আমাৰ যে চাই আছে বা আমাৰ young ladies যে চাই আছে, how to handle emotional stress.
যে most mothers that in and if we accept it, we would not like to talk
Okay,
about
yeah,
it.
I have seen this.
So that, and our third, যোনবিলাকে accept কৰিছে, and you talk about, you think you are best equipped like এইটো, মানে you should do it professionally, like go to a professional therapist and do it the proper way, and নিজে মানে বহুতখিনি বস্তু পৰা আঁতৰি পেলাই বেলেগৰ হতুৱাই কামটো, your job is to just identify the malady, কি অসুবিধা হৈছে, কি problem হৈছে, আপুনি identify কৰি put that girl, child into the right hands.
Okay, that's it. So বহুতখিনি কথা গম পালো আজি। Your session was very informative and very helpful. I suppose
Thank you.
yeah, it was very nice talking to you, and এনাজৰী টিমক আজি মই hey thank you ক'বলৈ বিচাৰিছো, ধন্যবাদ ক'বলৈ বিচাৰিছো যে আজি আপোনাক আনি ইয়াত আমাক ইমান ধুনীয়া এটা হেৰি দিলে, opportunity to know things which all the women out there, এতিয়াও বহুত কথা থাকি গ'ল, তথাপি আৰু এটা সেশন যদি আমি হেৰি কৰিব পাৰো, মই
It was my
মানে
pleasure. It was my pleasure.
it was very nice talking to you, and I'll thank Enajuri team's Milan, who started this kind of a initiative he has taken to bring about people so that they give uh, like you said that we all need to work together in a society. আমি সবে help এটা কৰিব লাগে যে তেনেকে let's hope that we carry on with this work. And Milan Anajury team, I would like to thank you for giving me this opportunity to talk to her today. So
Thank you.
okay.
Thank you, both of you.
Okay, thank you.
Yeah.